serotogenic receptor. Next, it is present in the somatic and autonomic nerve endings, and it is responsible for pain, itch, coronary chemoreflex such as bradycardia, fall in blood pressure due to withdrawal of sympathetic tone, respiratory stimulation or apnea elicited by stimulation of receptors in the coronary bed, and other visceral reflexes. Okay, so 5-HT3 receptor, when it is present in the somatic and autonomic nerve ending, it is responsible for generation of reflexes. Like, as we know, like for example, coronary chemoreflex you take, and we know that whenever there is fall in the heart rate, that is when bradycardia occurs, the baroreceptor will get activated, and the reason behind this activation of baroreceptor is nothing but this 5-HT3 receptor. So it is mainly acting as a reflex. Next, nerve ending in myenteric plexus causes augmentation of peristalsis, even emetic reflex. Okay, so myenteric plexus is nothing but the neurons present in your gastrointestinal tract, and here 5-HT3 receptor is present, and it is responsible for two things. First one is peristalsis, and second one is emetic reflex. Next, area prostrema and nucleus tractus solitarius in the brainstem will lead to nausea and vomiting. Little bit we'll check out regarding this third thing. In the brainstem, more appropriately you can say in the medulla oblongata. So suppose this is a section, a cut piece of your medulla oblongata. On the medulla oblongata we have got vomiting centers. Few other structures of medulla oblongata is this. This is nucleus tractus solitarius. This is area prostrema, and on the area prostrema we have got chemoreceptor trigger zone. So here we are on the chemoreceptor trigger zone, we can find various receptors binding sites such as 5-HT3 receptor, H1 receptor, G2 receptor, even muscarinic receptors are these all are the receptors present on the CTZ. Okay, even nucleus tractus solitarius have got 5-HT3 receptor. Now we are since we are talking about serotonin 5-HT3 receptor, we will concentrate in that only. So whenever this serotonin binds with the 5-HT3 receptor of CTZ, that is chemoreceptor trigger zone, then what will happen? It will cause activation of this chemoreceptor trigger zone, which in turn causes activation of area prostrema. Activation of area prostrema will cause activation of nucleus tractus solitarius, which in turn will cause activation of the vomiting centers. Okay, so when vomiting centers will get activated, then what will happen? Obviously vomiting will be taking place. So whenever 5-HT3 receptor present on the CTZ as well as on the NTS, that is nucleus tractus solitarius, wherever 5-HT3 receptor is present either on the chemoreceptor trigger zone or in the nucleus tractus solitarius, whenever it will get activated, it will cause activation of vomiting centers, and because of which vomiting will be taking place. So how can we reduce vomiting? Yes, we can reduce vomiting by blocking this 5-HT3 receptor on both CTZ as well as on the nucleus tractus solitarius area. So we have got drugs such as ondansetron, granisetron, palanosetron, tropisetron. So these drugs can be used as anti-emetic agent. So it is mainly used in the treatment of chemoreceptor triggered vomiting or radiotherapy induced vomitings. For these vomitings we can use these cetrons.